Good afternoon. I'm Mark Roper at WNAR2 News, and we are joined today with Dr. Roland Thorpe. He is the professor of health, behavior, and society at the Johns Hopkins Bloomberg School of Public Health. So, Dr. Thorpe, this is Men's Health Month, and I'd like to talk about what are some of the unique issues facing African American men when it comes to health.
Wow. Well, Mark, first of all, thank you for having me. That's a very good question. I would say that, African American men have the shortest life expectancy compared to white men, Hispanic men, and including white women and black women. And in addition to them having this shorter lifespan, they also have greater greater chronic condition diseases and greater onset of diseases, earlier onset of diseases. And most of the time when they show up at the doctor's office or more in the emergency department, they have more progressed illnesses. And so I think these health issues, I don't think it's just one health issue. It's a combination of all of these health issues that African American men face. And I think the reason why they face these issues is largely a lot of social issues, right? So we're thinking about structural racism and how structural racism has played a role in access to health care for Black men, and also, in addition to structural racism playing a role in that, how it directly affects Black men's health.
I mean, looking at your title is Health, Behavior, and Society. So it seems like you must have some experience or background in this area in terms of how do we fix it?
Well, so that's a tall order. So how do we fix it is that there are a couple things that we do to fix it. One of the things I think we want to do is we want to forever situate this and in the context of structural racism, because and the reason why I say that, because structural racism actually confines the individual choices that Black men operate. So, for instance, most Black men live in these urban areas, and most urban areas, we live in a highly segregated society that's impacted by that is a form of structural racism. And within these, as you know, within these areas, the segregated areas, oftentimes, they're despondent condition, high crime areas, high poverty. So then no one feels safe about going outside and engaging in physical activity, for an example. And most of the time in these areas, there's this constant advertising of negative health behaviors like alcohol consumption and cigarette smoking and these things. And then also within typically these despondent areas, that we have these poor housing conditions in which these Black men live, and many of them in low wage and jobs. All these have linkages to health outcomes as it relates to Black men.
And based on what you're saying, what does that do for the overall mental health?
Oh yeah, so yeah, that's the mental health. It actually greatly impacts the mental health. And one of the things that we don't really know what the true prevalence of mental health in Black men is, because Black men typically don't talk about mental health because they see that as a weakness, and there's a stigma associated with seeking out help for mental health. People may think that Black men may be crazy if they go seek help, and which I want to make sure that's the farthest thing from the truth. But I think that's the society and how we operate.
It also takes a bit of, I would say, courage and bravery to seek out that help, I would say.
Yes, it does. It does take a lot of bravery, a lot of courage to take that first step. And, one of the things, Mark, that I also think is very courageous, having said that, is one of the things is early detection and screening. Very few Black men, even those who have insurance, which equates to access, very few have annual visits. Why is it important to go to the doctor to have your annual visits? Because if we detect early, I said, oftentimes we show up in the emergency room with more progressed illness, or if we only go in because something is bothering us, hurting us, rather than thinking about these annual visits as being able to make sure we have these preventive screens. I always typically say, by and large, men in general, but I've seen this a lot with African American men. I say this most of the time. There's a group that believes in health repair versus health maintenance. What I mean by that is that we won't necessarily go to those annual visits, and but when we do show up to the doctor for some reason that we really have to go, then we've in making those observations, other things are discovered. And if we would just go on a regular basis, provided that we have the access, I think that some of these early detection things will provide us the opportunity to live a longer, fuller life.
Why do you think a lot of guys have a tendency to avoid those symptoms? When you know your own body, and when something doesn't feel right, but a lot of times you kind of tell yourself, well, this will go away, or it doesn't hurt that much, or it's not that bad, and you practically have to be on death's door before you do show up at the hospital.
Yeah, so that's interesting. So I think that changes as you get older, right? So I think younger, early in life, most younger men, they have this sense of, I can stick it out, I can tough it out, it'll be okay, and as we get older, oftentimes if you get older, many of the you have these tweaks and aches, then they don't go away as easy as if you were when you were younger. Your recovery time and even your recovery time and just engaging in physical activity is a little longer. But I think what we want to do, Mark, is we want to engage. We want to make sure that men know that it's okay to go get checkups. And we also, the other thing, Mark, is that we want to make sure the healthcare system is available to us.
I'd have to say for myself, even a few years ago, I started noticing I didn't even know what you would call it, but I don't know if you call it a heart palpitation, but I had a certain feeling in my chest every now and then. Wouldn't come from necessarily working out. I could be sitting down and watching TV, and I felt these sensations in my chest. And I myself thought, well, it's not really that bad. I only felt it for 5 minutes. It'll go away. And it lasted for a while. And then finally, well, I think probably what it took is that my brother had a quadruple bypass. And then when I told other people in my family that I had those feelings, people were telling me that I needed to get checked out. And finally I did. And luckily, when I did go to the doctor, it turned out to be nothing. I was almost disappointed in a way that they couldn't find anything wrong with me. I'm relieved that there wasn't anything wrong with me, but it made me feel like, so why did I have those symptoms? But, I guess sometimes it can take other people in a way showing us what happens if you don't. If you ignore those symptoms, what can happen to you as a wake-up call.
Yeah. Also, and just making sure, for that's good that you went in to get checked up. But the other side of it is, Mark, is that when we lose Black men in society, we don't just lose an individual; we lose a part of society, right? And that's really important. I think what I encourage people to do is, if you don't want to do it for yourself, think about your loved ones, what you potentially may leave behind if we don't think about engaging in, some going to the doctor and, possibly engaging in these more positive health behaviors. Now, don't misunderstand me, Mark. I want to be clear. I know we all can't do it all at one time, and I'm not suggesting that you go cold turkey, right, and just take off and do everything at one time. But I am saying that we could just start taking one step in the right direction. I think we will all be in a better place.
What are some advice that you would give to Black men, I guess, for themselves and also for maybe, their children?
The piece of advice I would give Black men is that if you don't have a primary care physician and you're in a position to obtain a primary care physician, please do so. Because a lot of the things that, a lot of these conditions that we end up being diagnosed with that are in later stages are probably some things that could be treated early on, or there are better treatment options earlier on, right? Prostate cancer is one, right? Most of the time we're more progressed illness for prostate cancer. If we would just come in early on, I think it would have been, you probably could have had more treatment options available to you. The other one, Mark, I'm glad you asked. The other one is that colorectal screening, in the colonoscopy, and, and no one, this whole notion of having a scope go up your anus, and that's not culturally comfortable for us, Mark, to talk about as Black men, right? So it's not, but it's something, and it's something that we need to think about doing, because colorectal cancer can take you out fast, and I think, we need to, I think one of the things we should be doing is when we get close to 50, when that's the guideline, if you don't have any other risk factors, 50, we need to start preparing for that and start educating ourselves on that exam itself. And by the way, Mark, if you're going to if you have a primary care physician, you can start that conversation. And your primary care physician probably should start priming you around 48, right? Because it's probably going to get 2 years to get you ready to go. But yeah.
Yes, I can attest to that.
Yeah, I got mine scheduled, I think in August. So I'll be going in August.
Yeah, I think you're right on the money there. I had a physical, I think it was in 2018. Doctor told me that, and it took me till, I think it was January of 2020 when I finally did it, because, it's just something, like you said, no one really wants to think about lying there in a
in a position that we're not comfortable being in, and the actual procedure itself. For me, my doctor started talking to me, I think 2018. I saw her in 2018. No, late 2017. I saw her and she started talking about it. It gave me some information to read, and then I read it, and then I went back to the whole culture thing. I don't know if I'm gonna do this or not. But then because you go to thinking about it, right?
Right.
He's like, I don't know, this might. But then the one thing I did do after that, I looked around. I went home for Christmas and I looked around at my family, and I was like, to me, in my perspective, I would be being selfish if I wouldn't take this opportunity to at least find out, because it could be nothing. Right. We'll see in August, and I hope it is nothing.
Right. Right. And that's what my doctor told me, that he said, if you do catch it earlier enough, generally it can be nothing. Even if there is something, if they catch it early enough, it turns out to be, practically nothing. They can take care of it. So that was comforting. I mean, I will say that even on that day, I was, I don't know if I would say scared, but maybe a little nervous, because you are very vulnerable in that position. I've never been in the hospital for anything, knock wood, my entire life. I've never been sick. So I've never had surgery of any kind. So that was really like my first time. And the doctor reminded me, said, you're not in a hospital today. You're in a clinic. But still, being put unconscious for a period of time where, you are not in control was a little, I don't know, nerve-wracking, maybe, for lack of a better word.
Yeah. And I think the healthcare team makes a world of difference. Like when the doctor conference say, well, you're not in a hospital, you're in a clinic, but I guess for you and I'm thinking, no matter if it's a clinic or a hospital, what is about to happen is not something that we think about often. But I think I would, encourage people to think about the larger implications. If something is wrong, let's get it checked out and get it fixed early on.
And I will say, once it was over, I couldn't believe that it was over, because 1 minute I'm having a conversation with the doctor, and the next minute you're knocked out and you don't remember anything that happened in between. And as far as like only a minute has passed between the time that you were talking to the doctor by the time they rolled you back into the room. And by that point, when everything came out fine, you do kind of think like, well, what was I so worried about? It was kind of like I had all this anxiety for nothing, really.
Part of it is the fear of the unknown, the fear of the unknown. So now that you've been through it, so when it comes up again for you to do another one, you'll be like, oh, okay, I can do it, because now you've experienced it, right? And right. you could be the voice for other Black men who may be, in the position that at least I was in 2017. I don't know about all this, I don't know. I'll be all right. And then, for me, I went to thinking, well, who in the family has ever had it? Nobody's in the family. And then I'm making up all kinds of excuses of trying to get away from it rather than just dealing with it. And so I'm actually looking forward to it, and just, deal with it. And my approach now is that if we find something, let's be aggressive and get it taken care of. Hopefully it comes back, everything comes back squeaky clean, and we can and we can wait to the next time I'm supposed to have the next one.
And that's the thing, like once it's over and you hear, hopefully the good news, again, you feel like, we got all worked up for nothing. And then even if it is something, the doctor said, they can take care of it, or they'll take care of it on the spot, and you're pretty much done. So,
yeah. So that's the other thing that I didn't know about it until I read some more up on it, is that if they find something while they're doing their procedure, if they can at that moment, they'll go ahead and take care of it. And so I don't have to go back and get in this position again.
Yeah, well, literally and figuratively.
Right. Both of them.
And I posted a picture of me from the clinic on Facebook, hoping that would inspire other people. And people did leave notes, thinking that I've been putting that on the back burner. So, hopefully even by us talking about this today, it will encourage some people to go ahead and make that appointment.
Yeah.
What other health concerns do you have for Black men, especially, like hypertension, high blood pressure are definitely big concerns.
Yeah. So, the big issue, is that with hypertension and diabetes, with hypertension and diabetes, they're both, and cancer, they're both strongly linked to being obese, and that's linked to the diet that we have, right? And so so we all like to eat our cuisine, no matter, it's high salt, high sodium, fried foods. And what I would say is that, one, for hypertension specifically, start taking the small steps that you can take to, it may be that you want to start walking, say I'm gonna walk, I don't know, a quarter of a mile a day, and then start building from there. And then think about, the other thing I would say, think about doing is, think about just changing small things in your diet. I wouldn't expect you to try to say, oh, you've got a hypertension now I got to go throw out everything in the refrigerator. But we want you to start thinking about making smarter choices to the extent possible that you can, right? Because it's just, quite frankly, it is very difficult, or it can be very financially difficult to purchase, fresh fruits and vegetables.
It costs a lot of money to eat well.
And that's one of the things people don't think about, right? Costs a lot of money to eat well. But the other thing I wanted to make mention of, because this is near and dear to me, is that take your medication. My father died from a stroke from uncontrolled hypertension because he never took his medication. Had insurance, went to the doctor, got the prescription, never took the medication, and got the prescription filled and never took the medication.
What was his reason?
I asked him why. He told me, he said he didn't want to take it. And I was like, okay, are you afraid of it? You don't trust the medication? Or he never really shared with me why he didn't want to take it. I did that because
the doctor?
Huh?
He didn't share with his son, the doctor?
No, he played the role of father. I don't have the answer to you. That's the role he played. But no, I think it's very important to be to take your meds and take them as prescribed, to the extent possible. And there are a number of that's not only with hypertension, but also, what comes along with hypertension is we have daily stressors, right? For particularly being a Black man, there are daily stresses, particularly thinking about the city of Baltimore. There are a number of, unfortunately, a number of shootings and killings that go on every day, and thinking about the over policing and the unarmed shooting of Black men, and just having that high anxiety level, which increases your stress of what's going to happen if you go outside, or what's going to happen if you get approached by law enforcement who don't want to follow the rules.
Do you think that the Affordable Care Act made any difference in terms of getting more people insured in the Black community?
So that's a good question. I would say, let me say this. The states that had the highest concentration of African Americans didn't take their Medicaid expansion. And so for us to see, particularly down in the South, the Bible Belt down in the South, Georgia, Florida, I think, and Alabama, Mississippi, many of them did not take and that's why a large proportion of African American men are in the South, and women, and they didn't take the Medicaid expansion. So, when it came out, I thought it was a great idea. And then when I noticed that those states weren't taking it, then the question is that, do we really expect to see a difference in health outcomes 5-10 years from now? I don't think so, because they never took the Medicaid expansion.
Right, because some of those plans, even on your own, can cost more than what some people pay in rent.
Yeah, so right, and some people's like, oh, what's the fine? And if there's a fine and the fine's cheaper than the premium, then I'll just pay the fine. So we have to think about more creative ways and how to engage, particularly engage Black men, and increase their awareness about the importance of going to the doctor. And I don't think it should, from my perspective, I don't think, Mark, it's about saying, Roland, you need to go to the doctor. I think we have to prioritize our health in a way that's meaningful for us, right? So, for instance, Roland, you got a niece. Maybe you want to go see your niece get married one day. So you might want to take care of yourself, because you see that you not doing that could put yourself in a position that you may not be able to see her get married. And then there are also, as it relates to there's financial circumstances as it relates to your health. So sometimes some men may be in positions where they're having to make decisions on, do I buy my medication or do I put food on the table? And then when you put men in positions like that, it's tough. I don't know what the physician would say in that situation, what physicians would tell you in that situation. But I know, many men will put the food on the table, and then they're going to say, well, I'll just figure it out next month. And hopefully they don't have heart palpitations, and they don't have a heart attack, or they don't have a stroke from uncontrolled hypertension before that next month.
Right. You'll worry about that when and if it happens and if it comes.
Right.
We'll deal with that. But right now I got to eat.
No, right. But this is a real thing, though. This is a very real thing, and this is what goes on in societies. And this is some of the things that oftentimes are not necessarily captured, in your encounter with the physician or the nurse practitioner in the healthcare setting. Because there's a finite amount of time you have in that encounter, and you're trying to get through whatever it is that you're trying to get through in that encounter. And some of these things just don't come up, but they're highly relevant to the behavior that's going to occur after, to you, what behavior you want this Black man to engage in.
Yeah. I mean, as you're saying about, you got to think about the reasons why you want to change your mindset. Like when my brother had the quadruple bypass, my sister-in-law, his wife, I mean, she told me, she said, I want you to make sure that you get yourself checked out. And between her and my mom constantly drilling that into me, I finally, got my butt to the doctor, and thankfully it turned out okay.
Yeah. So yeah, having people, special people in your life that come to you the first couple times in a nice, sensible way is important, right? So I'm pretty sure after a while, you can't ignore mom, or you can't continue to go to mom and say, yeah, I'm gonna do that tomorrow, because mom raised you, she know how you are, right?
Right.
So yeah, you're having those people or having an accountability partner to check on you and say, hey, when is the last time you've been to the doctor? I think it's important. And one of the other things I think we don't do a lot of, Mark, is we just don't have conversations about our health issues with one another, right? We just don't do that. And particularly in the Black community nowadays, I don't think many of us really know our whole family history. Some may not. Right. I'm from the South, and we used to have family reunions, and at the family reunions, then we used to try to gather information on, what Nanny had. And then, if Nanny had sugar, then we need to watch, we need to watch out, because sugar may run in the family. Right. And or high blood pressure, don't. And, the big thing is, we would try to figure out what people had so that we can try to get a good documentation of the family history, so that when we go to the doctor, when the doctor asks, do you have a family history, you will be able to give them some information.
Yeah. I mean, when I told my doctor that my brother had the quadruple bypass and my father died of heart problems, and I think my grandfather on my father's side as well, the doctor was like concerned. But again, as I said, thankfully for me, they couldn't find anything. So I don't know what was wrong with me, but they couldn't find anything.
Well, that's good though. That's really good. But the other thing I would say, Mark, is that just having a conversation with one of the things I would like to do is to sit around, have a conversation with some Black men about health. and to start that engagement. And then, prostate cancer survivors do it, and they do it well, right? All the time. They have all these, support groups, which are in place. And I think that's great. And there's also a number of people out that are doing awareness around prostate cancer, which again, I think that is absolutely great. But I wonder if we could learn from them and have awareness groups and have conversations, support groups about just going to the doctor in general, not having to have that incident or that teachable moment to get us there.
Right. Yeah, because that's what you don't want.
That you don't want the teachable moment, but the moment you have it, then now you're the crusader for whatever it is, right? You're on and you're marching for whatever it is. That's what we're trying to avoid, is trying to have a support system in place, right? So, so that we can try to have conversations and help one another out.
Yeah, well, hopefully just with us talking today that, somebody will be listening and watching and thinking, that doctor visit or physical that they've been putting off for a while, that now's the time to pick up the phone and make that appointment.
Yeah, I think it's important. I would encourage them to do that, when they go to the doctor. And one of the things I would say is, if they've never been to the doctor, it could be overwhelming. It could be an overwhelming experience. You may want to take someone with you. The other thing about it is, if, I tell people all the time, and I do this myself, PhD and all, I write my questions down on a note card, because I might get in there and it might, I might get in there and things may go different. And I have a set amount of questions. And when I get there and when the doctor comes into the room, I typically say to her, before we start talking, I have some questions that I want for us to discuss. And then, of course, she goes through, the profile and all that, and then she'll allow time to ask questions. I think it's about going to the doctor is about establishing a relationship and open, you got to have a relationship there, and to be able to be a part of your health is really empowering.
Yeah, I mean, you can't have any closer relationship when you walk into a room and they tell you to put on this tiny little gown and I'll be back to see you.
Right. And your back is all out and you got a little tie across the back. Right. So it can't be. Yeah. And it gets real at that point. Right.
Right.
It gets real. So, and from that point on, you're already, you're already there. You may want to maximize your time, and just to be honest with yourself. If they're asking you to do something that you can't do, it's okay to say, I don't think that's going to work for me now. Is there something I could do, instead of that for now, until I can build up to getting to do that? Or, some of those things, because it's just sometimes they just give us the stuff to do and we know we can or we won't do it. It becomes a problem.
Yeah, I know the last time that I had a physical, the doctor told me when they got my blood test results back that I was, I think, borderline high cholesterol. So he said, I want you to cut out dairy. I want you to cut out cheese. Pretty much anything that I like to eat.
Right. Right. So, yeah. So, it's interesting. The last time I went was November. Yeah, this past November, I went in and my blood work was fine, but I'm obese, right? So, and she says to me, everything looks good. And I jokingly, because she's been my physician for over 10 years. So we have a relationship. And she says to me, you really need to lose some weight. And I said, my numbers are good. What's the problem? That's what we're looking at. All these numbers are good. She was like, you're on borrowed time. It's only a matter of time. It will catch up with you. So you need to start losing weight. And so I never thought of it that way. I always thought of, I'm good. My numbers are, everything, my cholesterol's fine. My blood pressure's in the right range and all this and my A1C is in the right range and all this. But I never thought about it that way. And so from that point, we had a conversation. She says, here's some things I think you need to consider doing. You want to reduce your weight, because these things could go, next time you come in here, things could go very bad. And, and so I was like, okay, I never thought about it that way. And so now I have lost some weight, and I told her I was going to lose some weight before I came back to see her next year. So I have lost some weight because I don't want to go in and have to deal with not having lost weight.
Right.
I don't want to go in and have to deal with that. But I think it's important. And when I got out of there, I called one of my good friends, and I shared with him what the doctor said. He and I talk about our doctor visits all the time, and he is not obese. And he was like, then of course now you get the real raw conversation. Well, what you waiting on, right? What you waiting on? You need to lose some weight. I could have told you that, blah, 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 but it's the fact that, he's my accountability partner and my workout accountability partner. And so, that's been helpful because I've fallen off the horse. And it's the point I want to make, Mark, to men out there. It's okay to fall off the horse. It's not okay to stay off the horse. It's okay to fall off, but it's not okay to stay off.
All right. You got to get back on.
You got to get back on no matter, it only hurts once if you get into shape. It only hurts once. You only have to go through getting in shape one time.
But the question of obesity has come under scrutiny recently, though, in regards to Black men or the Black community overall, because there are different standards or different, I don't know if standards is the right word, but certain things that maybe not being taken into consideration when defining like what qualifies as obese.
Yeah, so that is come under scrutiny. So there are other measures that could be used beyond just the body mass index. Because take for example, football players, particularly offensive and defensive linemen, they're automatically severely obese, right? But they're probably some of the most well-conditioned athletes in the world. So if you look at their numbers, they're okay, right? But the moment they stop all that high-level conditioning, things go downhill. And I think you're right. There are other conditions like waist circumference that it's just the measurement around your waist, and that doesn't necessarily have to take into account of your height and things. But I think the charts that they use, I think they could be. The charts they use may not be appropriate for African Americans, but I think at the end of the day, I tell people, let's not get caught up in the technicalities. At the end of the day, if you know that you are overweight, and we know that being overweight or being obese is linked to these chronic conditions, let's try to avoid, to the extent possible, avoid putting ourselves in those positions. And if we're in those positions, let's start doing what we can to reduce our weight and manage, our eating and increase our physical activity, or the things that we could do that help us lose weight.
I will say, like for myself, I've been told that I think in signing up for the gym once that they said I was borderline obese, and it's like I'm 5'10" and weigh 200. If that's the definition of obese, then
yeah.
I hate to show you some people at the mall.
Right. And they would be considered obese as well. As well. And that's why I typically I typically don't pay attention to the BMI. I do pay more attention to my waist circumference, because that's just, right around your waist. And and we know that if you have a pear-shaped body as it relates to obesity, and your obesity sits in your stomach area, we know that is linked to diabetes. So we know we want to start reducing that body fat to the extent possible.
And I know you have to go soon, but one last question. What would concern you the most about the health and well-being of African-American men today?
What concerns me the most about it? What concerns me really the most about African-American men, the health and well-being of African-American, is this shooting of the unarmed Black men. That contributes to the shorter life expectancy, right? It's just this shooting of the unarmed Black man and the social ills that we still live under that put us behind as it relates to, wealth, educational opportunities, which we all know these social factors are linked to health and well-being. Those people who have higher education tend to have better health trajectories. That's not necessarily the case for Black men. And so we want to think about what is it that can be done to put Black men on a better health trajectory. What I think we need to do, Marcus, I think we need to have some infrastructure, training and infrastructure in place so that people can monitor monitor health and well-being. Now we're talking about Black men today, but this could be expanded to men of color, many men of color. We have offices of women's health, but we don't have offices of men's health. And I want to be clear. This is not a zero sums game. It's not bring on men's health and get rid of women's health. I think we can have both operating together. And we've improved a lot on women on a lot of fronts as it relates to women's health. We still got a long ways to go when it comes to Black women and maternal morbidity and mortality, but I think we have made some improvements. I think we should have some type of infrastructure and training in place and awareness, because it's a matter, Mark, it's a matter of just sitting down and talking to brothers about having frank conversations. A lot of them are not aware of some of the things, and some things that they think are true are not necessarily true. And, you hear these things off the street and you just take them for granted. And sometimes you have to demystify the myths.
Thank you, Dr. Thorpe, for your time today. Hopefully we got conversations going with some people who are watching and listening. And like I said, hopefully somebody will decide to call their doctor and set up an appointment right after watching this.
I hope so. Thank you for having me.
Thank you. Have a great day.
All right, you too. Bye-bye.
Bye.